Good morning, Wakefield, and sorry to say that welcome you back to one of our Friday COVID updates, which I anticipate we will be continuing for the foreseeable future. But thank you for tuning in, and thank you WCAT for setting this up again, and this is also on Facebook, so people can view it at their pleasure, I guess. In any event, as we're all been seeing the national news and the local news, that we seem to be back in the midst of a little bit of a variant here. And I know we're at the Delta variant. I hope we're not going to be talking about a zebra variant in a while, but that's where we are. So I'm going to turn this over to our health agent, Elaine Silva, for a few comments on where we are and what she foresees. Thank you, Elaine.
Good morning. I didn't perceive it to be this, exactly like this, to be honest with you. Good morning, everyone. Sorry we have to get together on this. I'd much rather get together to prepare for maybe a hurricane or something and have Mr. Walsh take over for a change. We do have an increase in cases. This past week, we went from Thursday till this Thursday, and we're up 26 cases. What we're seeing definitely is breakthrough cases. These are cases of people who have been immunized. We do presently see an increase in the younger children under 12 who unfortunately are not age eligible to be vaccinated at this time. Most of them are catching from either daycare, some camps are still in progress, and a lot of cases are coming from, believe it or not, is travel. Everyone is traveling here and there, going to different states. Everybody has a different mandate across the country. So people are very, very confused. And we tend to, sometimes we let our guard down. And I think we all know that. What we're seeing is the cases are mild. There are cases of people who just think they have a cold. Some people are not being tested until well into a week after they've developed symptoms. People who are vaccinated have been very grateful that they have been vaccinated and said that their symptoms are just so low. There's 57 cases open that we call active right now. We have not closed them. We are reinstating the contact traces here, and I thank the town of Wakefield for being so cooperative and so quick as to get these people back into place to do them. For those who don't know, the contact traces, we get the case through a state reporting system, and then we investigate them. Unfortunately, the contact traces, I'm sorry, I'm going with 50,000 things this morning. Contact traces from the state were supposed to be gone by September 1st. Everybody thought we'd be fine. So they kind of lowered their staffing. And when they lowered their staffing, all these cases came in. Many health departments at the time don't have a public health nurse or don't have anybody. Everybody's kind of been lackadaisy. So they've had a backload of even over 3,000 cases. And some of the cases that they took, they sent back to us to do. So a lot of public health departments are trying to catch up. We have a couple of contact traces that have restarted up this week in Wakefield. The public health nurse and myself have done the rest of them. We're doing them all weekend and at night. People are very, very grateful. And the one thing I think is that we apparently got some type of an education across about what to do if you thought you had COVID or if you were diagnosed with COVID. We seem to have people, even if we don't get a report for a couple of days or get to them, they've already put themselves into isolation and they've taken all the precautions, which is very, very helpful and very, it makes me feel good to think that we did get something across and that somebody learned something. We're reminding everyone, if you're not vaccinated, please get vaccinated. There are still places, mass.gov. And for those, I know that a lot of people have the question of what to do if they've lost their vaccine card. There soon will be a website on the website for mass.gov, hopefully soon in the next couple of weeks, a link for those who got their vaccines at a large vaccination site, such as Fenway Park or even the Doubletree Inn. There'll be a link so that you can go and link onto that, and it will give the information on how to obtain that. It sometimes is difficult. There's lots of duplicates, believe it or not, in the system. People's names were wrong, spelt wrong, or the wrong date of birth. So they're 2 or 3, and we have to differentiate them. But we're hoping in public health that we kind of see a little bit of a downward of this. A lot of it could be too, where this type of virus is one that you're asymptomatic. You don't know that you have it. And we have a lot of college students returning, a lot of people returning to work, and a lot traveling. So there's more people being tested. The amount of people being tested is phenomenal. I think we had over 1,000 alone in Wakefield tested this week. And that's a good amount. I mean, people are very cautious and people are very aware of it. And somehow I think that educational piece got across. And I think we should be proud of that, that at least we did tell people how to do things and how to handle it.
Great. Thank you, Elaine. Tom Walsh is here with me, so you're going to hear him and have to look at me.
Good morning, everyone. Basically, we're monitoring all of the numbers that are coming in. We're going to keep, we'll probably have some type of record on where we'll be as far as if they escalate too much, we'll probably make some changes. I want to talk about the contact tracing though, because we've ramped up that. I need the people to respond when you're being called.
Speak up. They're having trouble hearing you a little bit.
When you're being called to this by the technicians to get the information, please let them know exactly what transpired, because that way there we can let other people know that they have a possible exposure. This will help us immensely in getting it done and hopefully stopping the trail of it. The other thing I wanted to mention was a lot of people have been asking about booster shots. Now the booster shots right now are still being talked about even by the federal government. So they're hopeful that maybe by October, middle October, we'll start doing that. Yes, and that's a possibility, but there also is, you have to have 8 months in on your shots on the vaccination before you can get this. So just figure out 8 months from when you got your last shot is when you'll probably be able to get that booster shot. So those are things that we really should be looking at. But the other thing is try to be safe. We're still asking people, look, if you go into a crowded area, it's not, put a mask on. If you feel uncomfortable, back out. And then the washing the hands. All those things are so important right now that we keep this going. This disease is 100 times more infectious than the COVID-19, this Delta variant. So if you just use caution and do what you were doing, I think we'll be all right. And that's what I have on that. I'd like to get over to, if I may, to the hurricanes. I know the people have been worried about the hurricane supposedly that's coming in. First off, it's more than likely going to be a tropical storm because it's not going to have sustained winds. So, and for this area, we're probably looking at a little bit of a rain, maybe 3 to 6 inches. 3 to 6 inches in some spots. You have to just know where you're at, what your zone is. We're a little away from the coast, so we shouldn't have any problem. I will say that last year, I had asked the town administrator, he okayed us to put a early alert system in so that everybody will have a warning when these type of things develop. And you can sign up, no cost to anybody in the community, that you sign up for this early warning system. It'll tell you when, hurricanes, tornadoes. The other day, they had a tornado warning put out, and they do both text and phone. So we'd like everybody to get into that mode. And also, what I feel is there's a thing called a microburst, and that's in between hurricane, tornado type of thing. This thing is a substantial storm, but it comes in very quick and it's out very quick. Now, last year we had that storm, and it caused the town over $100,000 in damage in like a 15-minute span. But these are the things that early alert system will let you know is coming, and then you can protect yourself. The other thing is, I would request this. On these sustained winds, when you have a tropical storm, the stuff in your yards, put it away. packet, those are the things that end up being like missiles coming into your house. If you get all that put away, you should be all right. And you see the light department and the DPW, they'll be cutting back trees, or you'll see we'll have contractors in. So some of that should already be done, but those are the things I worry about. The last thing I would say is the people who are on life support systems, make sure they check with their medical providers on if there is an outage in the area. Our light department's pretty good, but they can't go out there if we have sustained winds of 35 miles an hour or more, because the people in those bucket trucks, you know, they're going to put their lives at risk too. So you just have to be that preparation. You have to be a little patient, but we will get to you.
Thank you. Thank you, Tom, for that little update as well. Superintendent Lyons?
Good morning, everybody. It's good to see everybody. It's unfortunate that we have to continue our weekly COVID meetings, but we're prepared to do it, and so it's good that we're able to connect in this way. We have completed our summer programming where over 500 students participated. That ended on the 13th. On the 16th, we started an acceleration academy for our kindergartners, and we have a few middle and high school students participating as well. But the majority of the program are our kindergarten students. We have 191 students in over the course of a few weeks. Things are going very well as we welcome new families to the Wakefield Public Schools. We did learn last night that a student tested positive. And Elaine, you do not have this data yet because it's not on the Maven database because it was a home test. So I'm sure they will be, you'll be getting information on that shortly if you haven't already. And so we were able to contact trace, and a few students were close contacts. So they are, they'll be quarantining and keeping an eye on symptoms. So with that said, I think, you know, on a positive note, if other students who were in proximity of this child were not masked, they too would have needed to quarantine. So just I guess a positive on the masking piece. And so we are meeting this Tuesday evening. School committee has a meeting at 7:30. We will be presenting our reopening plan. And as part of that plan, we will also be presenting our updated face covering policy, which would require all students, faculty and staff to be masked in grades pre-K through 12, as well as post-academy. So we've taken kind of the guidance of the Mass Department of Elementary and Secondary Ed, Mass DPH, as well as the American Academy of Pediatrics, and probably most importantly, our local Board of Health, right? So we appreciate that guidance and support that we received from them. But that's the work that we have upcoming this week. And so we're back at it and paying attention to data and supporting students. So we're looking forward to welcoming everybody back. So that's where we are at on the school side. Thank you.
Thank you, Doug. I'm going to turn it over to the vice chair of the town council, because I think our chair needed to jump off, if I'm not mistaken.
Yes,
Marie, if you could jump in. Thank you for joining us.
No, thank you for pulling these back together. Julie sends her regrets. She was on for the first half hour and then had to go to the day job, but she, like me, just wants to thank Elaine and Lorraine and Candace and Tom and everyone else who is working on this as we deal with the Delta. I think we, the entire town council, were hoping we'd be at a different stage, and we are not, but we appreciate all the work. And Doug, thank you so much for that update. And I'm looking forward to watching your Tuesday meeting with the update face covering policy, as I've been getting as school committee member Ingalls knows, who's also on this call. I've been getting calls and emails from parents wondering what was going to be happening as children return back to school. So, and again, I'm looking at Jen. Thank you all for what you are doing.
Thank you. Thank you, Maureen, for hanging on. I know Maureen has a day job too, so thank you very much. Laurel.
Good morning, everybody. You know, Elaine speaks for us all. And again, we thank you, Elaine, for jumping in and covering the health department during these really critical times. I would say that we need, first, I'm feeling really grateful that we live in the Northeast, where we have a more cohesive approach to mitigation. I will repeat my favorite model for mitigation in regards to COVID-19, which I borrowed from CDC and the American Camp Association regarding the Swiss cheese model. And basically that's if you can put a whole bunch of slices of Swiss cheese together, not one thing is perfect, everything has a hole, but all together they make a pretty solid barrier. So I think that we need to support the kids and each other in continuing mitigation. I think we're changing the vax or mask to just please mask again. We need to be patient with each other. We need to be kind. I will tell you, I have had the opportunity to speak with both caregivers and COVID survivors who had tremendous consequences from either the virus itself or working around it endlessly. So as solidarity, I would remind people to please keep it up. No one thing is perfect. Masking is not perfect. But it's certainly, it's a mitigation strategy. And then I've come up with a little bit of a metaphor in regards to how people say that, that the vaccines are a failure. So if you indulge me, I'm going to share a little story, which is, think of your house and your yard and your property, and think of your immune system as your house, but your nose as your front yard. So these hooligans come onto your front yard, but you have a bodyguard at your door. So if they get to the door, the bodyguard's going to take care of them. But in the meantime, you got everybody in the front yard who could cause trouble. So your bodyguard, if need be, is going to have to fight a hooligan or two. And you might break some furniture, meaning you might have a cold or some light symptoms, but you won't lose your house. However, the same group of hooligans can go to your next door neighbor who may not have a bodyguard and burn that house down. That's my new metaphor based on science that I've seen lately, but I think it's just sort of helpful to think of it that way. Elaine is cracking up. You can all take it. I haven't, but people have told me they find it helpful. So that's my last word today.
Thank you, Laurel. A couple of let me get a couple of positive notes. Wakefield positivity rate is at 2.43%, which is not too shabby considering where we were way back when. We would have killed for 2.43%. And I'm glad that a lot of people are getting testing. I think we had 2,100 tests of Wakefield residents during the last 2 weeks, which is good. So people are taking it seriously. On the vaccination front, and I got to say, what a wonderful job that you all did in getting out the message and having these clinics that we had here for vaccination. When I think about our more vulnerable population, the older people, those 75 and over, 93.5% of them are vaccinated. Isn't that wonderful? 65 to 75, 90% of them, fabulous. Even my age group, I'm still in this age group, 50 to 64, 88%, really good. We are seeing people inch up a little bit in the 20 to 29-year-olds, and I don't quite understand why more aren't getting it, but that has inched up to 69% having at least one shot. So for those of you that are in that age group, and many of you I've known over the years growing up with my kids, is that if you aren't, I don't understand why. So please do yourself and your loved ones, your nieces and nephews, your children a favor and get vaccinated. But we've been inching up slowly there. At what we've done in our buildings is we have maintained the preventative measures that we put in. We kept up the plexiglass, we kept up the moving people around, what have you. a number of my colleagues in the area took down the protective barriers when they thought this was over. Thank God we didn't. I will be, we'll be looking at our town buildings and whether we should adopt something. We'll be talking to the council about that, even more stringent. Right now, if you are not vaccinated, whether you work for us or not, you are required to wear a mask in here or asked to wear a mask in here. Any items, any events at the senior center where there is some close contact, those people are asked, are required. I should say, Judy, our senior center director, asks very nicely about masking, and people are complying with that. I did want to have actually got some questions from people regarding flu shots, and I want to put out, if I'm wrong, Elaine, let me know. Flu shots will be rolled out in a month or two like we normally
Yep.
do. So let's not forget about the flu shots. Actually having some people calling and asking about that. So stay patient, that's going to happen too. I do like the Swiss cheese metaphor better than the house metaphor, Laurel, but that's okay. That makes that I can visualize that. Being a provolone guy though, so I have to really think. Doug Lyons wanted to add something about vaccinations because this is very important for people.
Yes, in the 12 to 19-year-old age group, we still have about 800 people that can get vaccinations. To support that effort, we are going to be hosting a vaccination clinic, and that information will be put online as soon as it becomes available from our vendor Cataldo Ambulance. But we will be hosting a vaccination clinic on Thursday, the 26th, next Thursday, from 1 to 5 p.m. at the WMHS, the Wakefield Memorial High School Field House, from 1 p.m. to 5 p.m. That clinic is for students, families, faculty, and staff. We will also be hosting another clinic on September 2nd from 1 to 5 p.m. as well. Those are on Thursdays because our working theory is that families might be going away on Friday, and we thought Thursday was the most accessible day. I'd like to thank Tom Walsh for his help and support in helping to set this up, as well as our Board of Health. But I can't say enough about vaccinations being a mitigation strategy that is something that is critical to help us get to a better place. Or it is a mitigation strategy that's going to help us in time to get out of masks and to stay on our normal track or our pre-COVID schedules. So we can't urge people to take advantage of that and take advantage of that, please. And again, if you are able to get a vaccination, that's for students 12 and older, and as well as for families, faculty, and staff, the clinic will be available. More information will be forthcoming. Thank you, Steve.
Thank you, Doug.
Yeah,
Tom.
Superintendent, I just want to let you know, I spoke with the company this morning. They should have that link by the end of the day.
Great. And we'll share that on our website as well. We do have a school committee member on board. I guess he can't get enough of this. Mr. Ingalls, do you want to add anything?
No, thank you, Steve. I just wanted to sort of be here so that I could just see what the different methods were going to be and what our cases were. Just trying to stay informed. Thank you, though. I appreciate it.
Thank you for joining in. Coral, anything that you'd like to add?
Yeah, the only thing I'd like to say is the restaurants in Wakefield have a growing concern about masks and people wearing masks. There are some restaurants that have put in a mask mandate for them to come into their restaurants. And I'm just asking the public to be courteous and considerate of people's wishes. When you do go into these restaurants, just wear a mask when you get in, and when you sit down, you can take them off again. It's a very simple procedure, and it keeps more people safe, especially in these confined restaurants, if you're not eating outside. And again, all these workers are trying to do a great job. So please give them a break and just honor their wishes.
Thank you, Coral. Important form. And on that note, Jen, we are going to be fine tuning our messaging a little bit, huh?
Yep, we did the W's campaign, which you probably remember was plastered all over Wakefield last year. So we're going to update it a little bit with more of a message about how we can all, kind of keep Wakefield open by doing our part using these mitigation strategies. And just one other thing, if you're ever interested in seeing the information about Wakefield specifically, you can go to wakefield.ma.us/COVID-updates. It's also along the top navigation. The state info comes out every Thursday, but they're huge spreadsheets with 50 tabs on it. So we try to break it down to make it a little bit easier to view. So you can hop on there to check things out.
Great, thank you. So unless anybody has anything else, I do thank you for joining us. Let's be safe, everybody, and let's keep Wakefield open by following all of these maybe somewhat very simple procedures. Okay, thank you very much, and everyone have a great weekend, and be safe on the during the hurricane or the microburst or whatever it's going to be, and don't think just because your umbrella is tied up that it's okay. Be smart, pull it out of the stand and put it in your cellar for the storm, because a very simple thing to do, right? All right, take care, everybody. Have a great weekend. Bye.